my name is Rocky. I'm the student nurse practitioner for today. I'll be doing your cardiac assessment. This video will be uploaded on YouTube for the course. Is that okay?
Yes.
Okay. So, what brings you to the clinic today?
I'm here for a heart exam for work clearance.
Okay. So prior to the assessment, we have taken the blood pressure both sitting up and supine to both arms, making sure that I compare those two and check for any blockages, check for orthostatic hypotension as well. So now I'm inspecting the neck and we're going to check the jugular venous pressure. So I'm going to have, okay, go ahead and lie down for me, 30 to 45 degree angle. I'm going to take a straight edge as well as a ruler system. And I'm going to be asking the patient to lie, okay good, turn your head to the side, marking the highest pulsation of the jugular venous vein, which is right here. I'm going to place the ruler by the sternal notch. Okay, I'm taking a straight edge right where I marked that highest pulsation. Okay, so the jugular venous pressure is about 3.5 centimeters. Normal is 3 to 5 centimeters. So it's about right. So you can go ahead and take a seat. So after I check for that, I'm going to be palpating for the carotid artery. So I'm going to be palpating one at a time. So I'm going to palpate right here. Checking for any thrills, heaves, or lifts. Okay, and then the other side, making sure I only do one at a time. So, okay, and pulses for both is 2 out of 4 by equal strong bilaterally. Now I'm going to be auscultating for any bruit, so I'm going to be using both the diaphragm and the bell. Good. Good. And no bruit should be noted. Good. Bruit is the swishing sound, and no bruits noted to both carotid arteries bilaterally. So after the neck, I'm going to be inspecting his chest. I'm going to be inspecting port shape, any abnormalities. I'm also inspecting his any abnormalities. I'm also inspecting for any pulsations of apical pulsations and precordial pulsations. No pulsations noted upon inspection. After I check for his chest, so right now his chest is symmetrical with regular even respirations. So after I check for inspection, I'm going to go ahead and palpate. I'm going to be palpating at the apical, pulmonic, Erb's point, tricuspid, and mitral valves. Those are located in your second intercostal space, the left sternal border. Pulmonic is at the, right sternal border is your aortic valve. The left sternal border at the second intercostal space is the pulmonic valve. Erb's point is a third intercostal space, left sternal border. The tricuspid is at the fifth intercostal space at the left sternal border, and the mitral is at the mid-clavicular fifth intercostal space, which is also your point of maximal impulse or intensity that is located at the fifth intercostal space, mid-clavicular line. So I'm going to go ahead and palpate. Let me know if there's any pain. Any pain or discomfort?
No.
Okay. Okay, and I'll go right over here. Thank you. So for any large tissue, I'll also be asking the patient to lift up their the tissue to the side. That way I could properly assess. And so after the palpation, I'm gonna go ahead and also palpate for the abdominal aorta, which is above the umbilicus left to the midline, so right around in this area. With the palpations, I'm checking for any thrills, any heaves or lifts, and there is no thrills, heaves, or lifts, no cardiac abnormalities noted to all points. Aortic, pulmonic, Erb's point, tricuspid, mitral, and abdominal aorta. So now I'm going to go ahead and auscultate. So at this time, I'm checking for any bruits. So I'm going to be auscultating at the same points: aortic, pulmonic, Erb's point, tricuspid, mitral. Mitral is also the PMI. And then I'm also going to be doing auscultating with abdominal aorta, both using the diaphragm and the bell. Okay. Okay. And at this time, I'm also checking for the physiological splitting of S2, which is the closure of the aortic and pulmonic valves. And it's best heard on inspiration. So go ahead and take deep breaths for me. Okay, good. Okay, checking at the tricuspid. S1 and S2 noted and very audible. No murmurs or extra heart sounds noted. No cardiac abnormalities noted. No friction rub as well. At those points, I clearly noted S1 and S2. I'm going to go ahead and auscultate at the abdominal aorta as well. Okay, above the midline, above the umbilicus, left in the midline. Checking for any bruits, no bruits noted upon auscultation. So now I'm going to be checking for the bell at all sides. Aortic, pulmonic, Erb's point, tricuspid, and also the mitral, which is the PMI. Okay, I'm checking the abdominal aorta, meaning checking for any bruits. Bruits is positive for bruit is a sign of abnormality. Okay, so I'm gonna go ahead and put this away. After I do that, I'm gonna be checking for I'm gonna be doing his peripheral exam, examining his color for cyanosis, examining any abnormalities such as edema, shunts, any varicose veins, spider legs. I'm checking for his temperature as well, to all his extremities. Making sure that it's warm, skin is warm, moist and pink, no diaphoresis noted. And now I'm going to be checking for his pulses, making sure I check both sides and compare both sides at the same time. Good. Radial pulses is strong and equal 2 out of 4 bilaterally. Brachial pulses strong and equal 2 out of 4 bilaterally. I'm also going to be checking his femoral arteries. Normally I would have, in a clinical setting, you would have a patient remove their clothing. But for the femoral artery, I'm going to be bringing down his clothing a little further down. It's okay. And then I'm going to be assessing both of them at the same time, just not in front of the camera. And I'm also going to be palpating for both of them for any thrills, libs, or lifts. And then I'm also going to be auscultating both with the diaphragm and bell. So I'm just going to pull your shorts down a little bit.
Okay.
And making sure I check with the bell as well, both sides, and compare both sides. It's a little further down. Okay. I would also do those for the pulses, for all pulses, auscultating for any bruits, both to all pulses to upper and lower extremities and palpating for any bruits. So after the femoral artery, I'm going to go ahead and do the popliteal, which is underneath, behind the knee. So I'm going to we go behind the knee and move my fingers until I find the pulsation. So it's 2 out of 4, strong and equal bilaterally. Now I'm going to check his posterior tibialis, which is behind his ankle, which is 2 out of 4, strong and equal bilaterally. And I'm also checking for his dorsalis pedis, which is in the palmar aspect of his foot. Okay. Making sure I compare both sides to all pulses, and it's 2 out of 4 equal and strong bilaterally. You can go ahead and sit up for me. After I check his pulses, I'm going to be checking for capillary refill to all his fingers, making sure it's less than 3 seconds, which is good. Normal, it's brisk. Good. I'm also checking for both fingers and toes, making sure I compare the two. And I'm also checking for nail clubbing, for cyanosis, for tar staining, as well as splinter hemorrhage for all of them. Making sure that I compare all sides. So I inspected, I palpated, I percussed, and I did the peripheral exams. The PMI was non-displaced, and it was at the 5th intercostal space mid-clavicular line. S1 and S2 were audible. The carotid pulses were both strong and equal bilaterally, and all pulses to upper and lower extremities are strong and equal, 2 out of 4 bilaterally. Otherwise, I think this is a normal and healthy exam. No abnormalities found, no thrills, no palpated, no bruits upon auscultations. Do you have any questions for me?
No.
Okay, this concludes our cardiac exam. Thank you.